TSA is a member of TSC International, a consortium of organisations that supports individuals with TSC around the world. TSC International recently published a companion paper to the updated TSC Management and Surveillance Guidelines. The paper, called Beyond the Guidelines, examines the state of TSC care around the world, identifies gaps in care, and makes recommendations for how TSC organisations and key stakeholders can work together to overcome barriers in care. Joining me today to discuss the paper and its findings, particularly as they relate to Australia, is Claire Stewart, one of the authors of the paper and TSA's former general manager. Claire, congratulations on publishing the paper. It's based on TSC International's Improving Care project. Can you tell us a bit more about that project, how it was conducted, and what role did TSA and people in Australia play?
Thanks for having me, Jackie. The project was a collaboration, as you said, of TSC International. So that's the alliance of all the TSC organisations around the world. And TSC Alliance in the US is a real leader for TSC International, really makes sure things happen. But there's a great group of leaders from Western Europe and other parts of the world as well. And for a few years, I was co-chair of TSC International, and the Improving Care project was a real highlight of that time. So the project asked TSC organisations around the world how we can improve healthcare for people with TSC. So the TSCI member organisations were all working in their own countries to raise awareness of what was then the 2011 clinical guidelines for TSC. So they're the guidelines that cover ongoing surveillance for tuberous sclerosis as well as treatment. But all the TSC organisations, including us in Australia, we knew that just promoting the guidelines wasn't enough. It wasn't going to make the big changes that we needed. So this project pulled together focus groups, did a survey, and also some interviews. It also reached out to some global TSC experts, so expert doctors and researchers, to understand their points of view on this pretty complicated question of how we improve healthcare. Most of the work was done, a lot of it face-to-face at the TSC International meetings that are held before face-to-face research conferences. So there was one in the UK, one in Portugal, and one in the US. And it's strange to be harking back and thinking about a time when we all used to be able to travel to see each other face to face. But that's roughly kind of what the project was doing and how we did it.
So what were your key findings?
Yeah, so this probably won't surprise people in Australia living with TSC, but there really is a significant gap around the world between what's recommended in the guidelines and what's actually available to people with TSC around the world. The project came up with 3 priority areas for action to improve this gap. So the first of those was around implementation of the guidelines. Then there was access to TSC expertise. And the third was coordinated and integrated healthcare. So I'm hoping this will resonate with the Australian TSC community, but the project, through all of those different things, concluded that those 3 sort of work together to improve healthcare for people with TSC. So the first one, which is implementation of the guidelines, that's all about making sure that people with TSC and their healthcare professionals actually know about the guidelines, because that's not a given. And when you think in Australia, we do really well, but in some other countries, there isn't even a TSC organisation. Or you think about a country as big and as diverse as somewhere like India, there's a TSC organisation, but in some parts of the country, they can't even get access to, a GP style health professional, rather than a group of specialists. So there's a huge variation. And our first step was just knowing about the guidelines, but also having access to imaging, particularly MRI scans, and access to treatments, including, but not just, anti-epilepsy medication and mTOR inhibitors. The second of those areas was around access to TSC expertise. So one of the really interesting things we found really early in the project was just how much of a similar approach TSC organisations around the world were taking in trying to solve this problem of really needing TSC expert health professionals. And the TSC organisations took really similar approaches to building partnerships with the interested health professionals. So it included having, you know, one-on-one meetings with them, really informally, inviting them to speak at conferences, referring more and more patients with TSC to them, funding little research projects that kept them interested. We jokingly sort of felt like it was like grooming those health professionals, and we all did the same thing. And this is actually really hard work, but the conclusion of the project was that this kind of building interest and cultivating their expertise and then growing from that was actually really fundamental to improving healthcare for someone with TSC. And as everyone knows, there's so many health professionals involved in the care of a person with TSC. It's almost, you know, multitudes of work to find, you know, the nephrologist in Victoria, the dermatologist in Queensland, you know, in Western Australia, you need a neurologist for children, a neurologist for adults, and you end up having this real diverse team. And it was great seeing how that was similar approaches taken around the world. The third part of that was around coordinated and integrated healthcare. So making coordination more a part of how TSC care is provided, but also particularly joining the dots to social care, which was a bit of a European-centric way of thinking about things, but also education and disability care in Australia. So really looking at care as being not even just integration in the medical sense, but integration with other aspects of the care that a person with TSC can need to live a really good life. And the paper overall recommends a bunch of different areas for action. So there's a few areas for future TSC international collaborations, projects that TSC organisations can do in their own countries, such as, you know, adding things onto Medicare or getting approvals for funding for medicines. And there's also a few different research projects that are identified in the paper. So we're hoping it gives the global TSC community a bit of a roadmap, bit of a to-do list, so that we can keep making improvements to healthcare. But underneath all of those recommendations was an overarching realization that the improvements we've already made in care are really dependent on the strength of TSC organisations in individual countries. And so understanding that those TSC organisations are pivotal, and that we need to, as a global TSC community, do more to encourage TSC organisations to form in countries where they're not there, and to strengthen TSC organisations in areas where they're fledgling, where they're just starting out and they're decades behind what we have in Australia, the US, and parts of Europe and the UK.
So how do you think Australia compares to other countries that took part in the study?
Yeah, so we're definitely one of the best places in the world to live with TSC. Now, I think Australia is one of the best places to live, full stop. But when I had those great conversations with people around the world, we're doing really well. We've got some great clinics with dedicated teams providing really, really great care for people with TSC. We've got funding for key TSC medicines, including all of the anti-epilepsy medications that are in the guidelines, as well as mTOR inhibitors. And that absolutely puts us towards the top of the list if you had a single list, which we didn't do. There were no league tables in this study. Now, you know, these services that we have in Australia, they compare pretty well with some of the big US centres that people might have heard of, such as in New York and Cincinnati. But the issue in the US is that there's so many people with TSC who don't have access to those big clinics because they don't have good insurance. And the same applies, we found, for medicines and imaging. So there's really significant gaps in the US if you don't have the right insurance and you need to access those things. So as a public health professional, doing this study made me even more passionate about universal healthcare, and, you know, looking onto US politics and realizing what that means for the US population has been quite interesting since then. So Western Europe has some really great models of care, and probably, you know, still lots of variation based on where you live, both in the sense of which country you are in Europe and the UK, but also, you know, regional and remote areas and whether you're allowed to access centralized services. So I think there's still lots of room for us to collaborate around the world to learn from each other, and improve access to those services. Look, we found there's probably more common struggles than differences, at least for high income countries. So everyone recognised and was really passionate about the gaps in care coordination and the implications of that. So that usually means there's a huge workload for families with TSC, whether that's the individual with TSC themselves in coordinating all their appointments, or parents, and particularly women, particularly this falls to mothers and, you know, mothers of adults that are continuing to have to play that role, because it's really hard work for adults with TSC to do that and juggle all those aspects of care. So I certainly think there was probably a lot more similarities in what the TSC organisations around the world felt were the biggest gaps than there were actually differences, at least, as I said, in the higher income countries.
And Claire, do you have an indication of where the largest gaps in care are in Australia?
Yeah, look, it has been 2 and a bit years since I worked for TSA, so I'm a little bit worried that this is a bit out of date. But I still do believe, and check this in with Jackie before this chat, that, you know, we still have fantastic clinics in Australia. And when Australians with TSC do have access to those TSC specialist clinics, they really do receive gold standard care. I think our biggest challenge in Australia is improving access to those clinics. So that means we really need, as a community of people with TSC and of health professionals, to get more clinics, stronger clinics for both children and adults in all states in Australia, and really make it a standard pathway for people with TSC to have a clinic that they go to. Now, that might not mean that they have to visit that clinic for every specialist visit, but that gives them access to a team of professionals that really do have both the knowledge and the expertise, and also the resources to be able to follow the clinical standards. So as I said, when I left TSA 2 years ago, there were still some pretty big gaps. And I live in regional New South Wales, and I know it's a pain to have to try and get to a centre. And, you know, I can't think of what it's like for regional Queensland, Northern Territory, far west New South Wales, etc. So I'm hoping that the increased use of telehealth that we've had during COVID-19 may help to improve access to those clinics, particularly for people outside of major cities. And then, you know, for people who are choosing not to receive care for a multidisciplinary clinic, perhaps it's an adult for whom, you know, it's really all about their kidneys. They might have a great nephrologist. I think we can still struggle with surveillance testing. And, you know, I'll never forget, there was a few families who had adults with TSC that actually got really sick, and some that passed away due to missed surveillance for SIGA brain tumours. And those are, you know, tragedies that we need to make sure as an Australian doesn't happen. If we can, you know, improve access to regular surveillance, we'll be able to make really good treatment decisions and not find out about these things before it's too late.
Thanks, Claire. And is there one final message you'd like to give to the TSC community in Australia?
Oh, from a person to person, I guess I just want to say I miss you all, and I hope you're all doing really well. But I guess from a bigger picture, just to keep supporting Tuberous Sclerosis Australia, because without TSA's work, we really wouldn't be where we are in Australia. I've started recently working with some other rare disease organisations, and that's actually made me even prouder of what TSA has already accomplished and is continuing to do for the TSC community on really limited resources. We're pretty darn efficient. So I want to just tell the TSC community to just keep supporting Tuberous Sclerosis Australia in any way that you can. So maybe that's sharing your story, maybe it's making a donation, doing some fundraising, talking to friends and family about the organisation, maybe it's volunteering in another way. So having sat in Jackie's you know, chair and tried to do that job, it really does make a difference, and it will keep allowing Tuberous Sclerosis Australia to drive all those little steps forward that are needed in order for us to continue improving healthcare for people with TSC.
Thanks so much for joining us today, Claire.
No worries. Thanks, Jackie.